Twitter as well too. So we'll be there. First of all, what's going on, everybody? Is yours truly, Dr. Pierre. So I started live streaming a little bit earlier on my Instagram. So that's why you'll see me kind of looking in this direction today. I wanted to hop on and talk about the recent news, right, of the new COVID vaccine player that is out. Now, of course, if you have been following along, with the lunch learns, if you follow along with some of the academic posts, okay, what's going on, bro? If you've been following along, we've actually been talking about, a new player on the horizon for about a month now. And, I was assuming that probably by the time March comes around, we would have at least 3 players in this vaccine game, in this fight to deal with the coronavirus, right? And, we got the news today after 4, I think it was like in the afternoon, after like 4 or 5 p.m., that the FDA actually approved the most recent player to the game, right, which is the Johnson & Johnson vaccine in our fight, in our long battle, right, against COVID-19, right, which is, again, extremely important, right? Again, we've talked about this before. This is not going to be a vaccine this is not going to be a virus that is just kind of goes away, right? Like, this is going to be something that's going to be here to stay, right? Now, am I telling you that we're going to be wearing masks forever? No. Right. But like, this is definitely something that, because we are fortunately behind on the 8 ball, right? Like, we're having to play catch up, right? Like the numbers kind of speak for themselves, right? And we'll talk about the numbers today, but I definitely wanted to kind of focus this live on just the aspect of now we got 3, right? We got 3, great vaccine players that are there, that are here to help us, right, in this battle against Corona. And like I said, it has been a very long battle, right? In fact, let me just typically do my academic hospitalist series where I just kind of shoot out some numbers, right? Just so we can kind of get a perspective, right, of what we're dealing with, right? So as we speak, 28.5 million people, right, have been contracted with the coronavirus, and 509,000 people have died, right? This is since last year, right? We're not even like a full year. I think, in fact, let me look now. The first documented case was March 3rd, 2020, right? So since 2020, 28.5 million people with an M, right, like have been diagnosed with COVID, and 509,000 people are not ever coming back home because of this virus, right? So this is definitely, this is why you see, physicians and health professionals and public health officials, this is why you see us scream from the rooftops, this onus of having to be very aggressive, right, against this disease, right? And for a long time, we had no help, no support whatsoever, right? But we got that now, right? Like around Christmas time, we had 2 players come out, Pfizer and Moderna, right? Those were 2 types of vaccines, the mRNA vaccines, which were newer vaccines, not new vaccines, right? I want to stress that because I heard a lot of people, fight against wanting to even, get this vaccine because they thought it came out of nowhere, right? So it's not a new vaccine, these 2 were, but it was the newest vaccine, right? So again, if you're following me, especially Instagram, if you're following me, I'm also live on my YouTube page, as well as in my groups as well too, because I'm going to be actually hosting some, showing some, some websites that I can't actually show it, unfortunately, here on Instagram, right? So that's why you're going to see me kind of looking down in this direction here. But so first thing first, I always say, especially for the general public, right? If you have any issues, questions, or concerns, right, and you want to know, where can I get some good information about the coronavirus, COVID-19, right? The CDC is always the site I recommend, right? It's very easy to read, right? It's not over the top, right? Like, you'll get what you need to get from it, right? Without being inundated, right? That was going without being inundated, right? With medical jargon, right? Like, because I think as a physician, that's what kills us the most, right? Is that we don't know how to speak to y'all. Right. And because we don't know how to speak to y'all, right, we start saying like crazy terms over the head, and then y'all just kind of tune us out. Right. So that's not what we're here for. That's why I love the CDC's website, because it's very easy to go after, very easy to learn and grab what you need to grab from it. So again, the CDC has a great website that literally just says understanding viral vector vaccines, right? And the reason why this is important, right? Reason why I stress this is because the Johnson & Johnson, the one that got approved today, by approved, I mean a unanimous vote said, you know what, we are okay with this vaccine going into emergency use, right? Which again, like we can definitely discuss, especially we probably won't do that this slide, but we can discuss what that even means, right? But the fact that it said, yes, we can go to emergency use where we know that the benefits outweigh the risk, right? And we're ready for you to kind of bring this out to the world like right now, says wonders, right? And the fact that, again, all 20 people said, yes, like, let's get this vaccine out to the people, says, again, like I said, you heard the numbers, 28.5 million, 509,000 deaths, right? And that number is probably outdated by the time I read it, right? And that just is what it is, right? So as we speak here, right, we have the newer player in the vaccine, right, which is a different type, right? Because when the first two came out, Moderna and Pfizer, what I used to hear is like, oh, it's this mRNA vaccine. I've never heard of mRNA vaccines. I don't trust mRNA vaccines. It came out of nowhere, which again, we have said that is not true, right? mRNA vaccines have been around for decades, right? Like it didn't just pop out of nowhere just because we're talking about COVID, right? But it just, again, that was some of the thought process, right? So here we have a new player, right? This is actually an adenovirus player, right? And in fact, I want to share my screen, especially for those who are watching me on YouTube, Twitter, or wherever you're watching me, just so you can kind of you'll get a nice little breakdown of the different vaccine players that are possible out here, right? So again, non-replicating adenovirus vector vaccine, that is what the Johnson & Johnson vaccine is, right? So again, and some key differences, especially if you're watching this graph, right? So mRNA vaccines, the Pfizer and Moderna, 2 doses. This one right here, 1 dose, right? 1 dose, 1 shot, and you're good, right? So again, that's one that helps us with compliance, right? That helps us, not have to worry about you maybe missing a second dose, or you may be getting sick in between your doses, which happens a lot. You'd be surprised. I take care of patients in the hospital, and a lot of times I'm taking care of patients who get sick in between. Even though I'm not saying get sick with COVID, but just get sick, because of life, right? In between the time frame, right? So we have a vaccine now that you get 1 shot, and you're good, you're protected to an amazing extent, right? And you're going to hear numbers, right? People are going to try to confuse you with the numbers. They're going to try to cloud you with the numbers to try to scare you, from taking one vaccine versus the other. But I think the most important thing, right, especially if we just think about it in layman's terms, right, the most important thing about these vaccines is what is your likelihood, right, of having to see a person like me. Right. Those who don't know, again, Dr. Pierre, I work in the hospital setting, right? I take care of COVID-19 patients every single day, right? And because I take care of COVID-19 patients every single day, I see them from the kind of mildly ill to the super ridiculously sick. And I've unfortunately seen a lot of patients not leave the hospital when I come take care of, right? So the question you want to know is, what is the likelihood that if I take this vaccine, you won't see someone like me, right? Like that should forget the numbers, right? You want to know in layman's term, what is the likelihood that if I take this vaccine, like, will you come to see Dr. Pierre, right? Are you going to see a hospice physician? Are you going to see a critical care physician? Are you going to see someone in the hospital? Because that's what you want to avoid, right? And this vaccine, again, does an amazing job at it. The numbers that came out are about 80. In fact, let me like I said, we'll get back to the screen here, but I just wanted to kind of show you again some kind of key differences. Like I said, it's a replicating virus. It's 1 dose, 14 days after the booster, you get an antibody protection, right? Again, the how many people got tested? 60,000 people were in that trial, right? Because again, I always get that number like, oh, I don't want to be a guinea pig. Trust me, you're not going to be a guinea pig. 60,000 people were in a trial that had opportunity to get that. So I promise you, you're not going to be number 1 or 10 or 100 who gets this vaccine, right? And the age range, again, is 18 and above. Again, we have not studied this vaccines in kids yet. I'm almost sure it's going to happen, right? But at least at this moment, as I speak today, we have not studied these vaccines in folks under 18, especially for Johnson & Johnson and Moderna. Now, Pfizer, right, as you can see here, went all the way down to 16, but that's it, right? So again, not for kids at this moment. So let me just shut my screen right there. And again, that's very important, right? Again, right now we're talking about the 18-year-old folks who have an opportunity, 18 and older have an opportunity to kind of get this vaccine. A very good question. I'm definitely going to answer that question. So I got a question on Instagram that says, how do you handle vaccine skepticism and hesitancy amongst patients of color? Right. Very good question. We are definitely going to get to that question because I feel that question every single day. And it's important, right? Why is it important? Right. And with just a quick caveat, fortunately, like all other medical illnesses, blood pressure, diabetes, cholesterol, strokes, heart disease, kidney disease. You pick a name, you pick a disease, patients of color are predominantly and disproportionately more affected than patients not of color, right? Especially African Americans, right? So you would think, right? Like it would just make sense that if I tell you COVID-19 is affecting, people of color at a much significant rate, like it would just make sense, right? And that's why, again, we want to, like I said, we don't need to break down the nitty gritty. It's just common sense, right? If almost every other disease, right, affects especially African American people at a much more significant rate, Hispanic people at a much more significant rate, right? Like you should assume that COVID's also doing that. And again, unfortunately, that is true. COVID is unfortunately kicking our butt, especially in the African American community. And what we're already seeing early, right, is that for those who have the opportunity to get it, right, those who have the opportunity to get this vaccine, especially when they break down by races, we are the lowest, right, in people who are actually getting it, which theoretically doesn't make any sense, right? Because you would think if we predominantly get this virus, right, and are predominantly affected, we would be the ones who be running to get it. It ain't happening. Lots of different reasons why it's not happening. We're gonna talk about that, but lots of different reasons why. So Johnson & Johnson, like I said, it is a one-shot vaccine. Some of the key differences that are going to be huge, especially for community, especially patients of color, right, is that the two vaccines that were previously approved, right, they had to be refrigerated in these deep freezers, right, in these ridiculous temperatures. And why is that an issue? That means that your local pharmacy, right, can't carry that vaccine, right, because your local pharmacy doesn't have a deep freezer in the back, right? Like that, it just is what it is. Your local pharmacy does not have a deep freezer in the back, and because it doesn't have a deep freezer in the back, it can't carry that vaccine. So most of the vaccines were concentrated in hospital settings and educational centers that could actually deal with it, right? So now that you have this third player out, Johnson & Johnson, that can be refrigerated like most other regular medications, this now opens up, right, the ball game, right? Because now much more avenues, much more opportunities, much more pharmacies, much more healthcare clinics, like a lot more people have an opportunity to get this vaccine, right? And because a lot more people have, and they already talking like they're ready to drop I think the number was like 30 million, like they're ready to let out a whole bunch of these vaccines out. Let me see if I can get a quick number for you, so I don't want to lie to you. Let's see how much Johnson said they're gonna get out over the next month. I can't see I don't see how much they said, but like it's in the hundreds of millions. Like they're ready to push out this vaccine. Like they're ready to deliver it on Monday, right? So that's it's happening, right? Like again, this decision came at a sooner time. Like I said, we crossed that 500,000 death mark, pretty quick, right? Like I said, we haven't touched a full year since the first diagnosis, and we already hit half a million, right? People died, people who aren't coming back home because of this, right? So you got this vaccine. So again, one shot dose. It's a different type of vaccine, right? Again, it is the viral vector vaccine. Things we want to get out of there right quickly. No, it's not going to affect your DNA. No, it's not going to cause you to have COVID-19, right? No, they don't introduce the COVID-19 virus as a dead virus into your system. That is not this vaccine here. This vaccine's been around, like these types of vaccines have been around since the 1970s, right? So again, there go your time issue, right? Especially for my people who are anti-mRNA. You don't got to worry about that. Like this vaccine has been around, right? So again, so now like the I'm hoping, right, the arguments against the first two, right, off to the wayside, right? Like we're not trying to hear that again, right? And what's even better, this vaccine was, because especially now the big talk is like all of these variants this, variant that, right? I follow Dr. Kizzy, right? She's actually on Twitter. She's like Dr. Kizzy PhD, I believe. She is right a head leader, right? And I want to say Moderna. Don't quote me. I apologize because I can't think of it at the top of my head, right? But like she has many tweet threads like saying like, guys, like we are aware that variants happen, right? And because we're aware that variants happen, like we're ready for them, right? And Moderna is actually, it is Moderna. Moderna is actually already working on, certain different vaccine variants for those specific variants that are out there, right? So, but the beauty with Johnson & Johnson is that it was such a worldwide type study. It had patients that were in these countries and in these areas, right, that the variants were very high. Right. So when you see some of their success numbers, right, I don't want you to be dissuaded. Right. Like I said, we're not even going to talk numbers now. Right. We're not even going to talk about the percentages, 85, like that doesn't even matter. Right. What matters is what's the likelihood of you seeing someone like me if you take this vaccine. Right. And it is significantly reduced. Right. Again, and this is what I try to tell people. Having COVID-19 is not the problem. Getting sick from COVID-19 is the problem. Seeing someone like me from COVID-19 is the problem, right? Like just having the coronavirus is not the issue. Why? And we know why we know that, because 28 million people in this United States got it, right? And only 500,000 people died, right? Which means we got a lot more people walking around, right, who had COVID, who probably didn't know they had COVID, right? Because we get a lot of asymptomatic trends. Like I said, that 28.5 million, it's likely closer to like 30 plus, right? Like if I actually tested everybody, because there's not a lot of people who get tested, who probably should. But like, and that just is what it is, right? So having COVID is not the issue, right? It's getting sick from it. And the goal with these vaccines is how can I decrease the opportunity for you to get sick from said vaccines, right? So again, we are very excited, especially on the forefront, the front lines, the people who, take care of these patients every single day, right? With COVID, right? Who have to, go home, right, to their family members, hoping that they don't somehow bring the virus to their family members, right? Like we do this every single day, right? And we are excited that we have another player out there. Especially because, there was an issue with the log jam of, not enough people being able to get it. I know there's certain parts of the countries where it's not open up to the general public yet. Like I said, I'm not the general public because I take care of patients with COVID-19. I was the first batch of people who had the opportunity to get the vaccine, and I definitely got said vaccine because I'd be crazy not to. Right? It just is what it is. I'd be crazy not to get it. So I was very fortunate with that. But like I said, like when it opens up to the general public, the fact that you'll have at least now 3 players to combat this virus, I think is going to be absolutely amazing, right? So I do want to touch on that question, right? Like how do I handle the skepticism, right? One thing for sure, right? Yeah, and then not just again, it has nothing to do with just Johnson & Johnson, right? It's the skepticism associated with just the medical field in and of itself, which is 100% valid, right? And that's one thing I always stress. I always let folks know I understand why you may not trust, right, this vaccine right now. Like because it just seems crazy, right? Because if you don't understand, you really are going to think like, wow, they were somehow able to, whip up a vaccine out of nowhere, right? Like you're going to think that if again, this is not a normal situation. We are in a pandemic, right? So, and again, we'll do a quick little history and quick little education on like how vaccines get out to play, right? Typically, let's say virus A, right? Virus A comes out, right? And then all of a sudden, a few people get sick. And then what typically happens, a drug company says, you know what, I may want to produce a vaccine, but I need to see if enough people will get sick. So, right, it's kind of worth my while. Guess what happened with COVID, right? A whole bunch of people got sick very quickly, right? So that's one step, right? The fact that you had a disease that was out there, and you had a disease that a whole bunch of people got sick very quickly. So the numbers shot up through the roof, right? So now you have the disease, a whole bunch of people got it, right? Now you have drug companies that are like, wow, I want to maybe see if I can make a vaccine for this, right? And then, but you know what? Vaccines cost money, right? Oh, guess what? Because a whole bunch of people, right, get this virus, right, and it's shutting down economies across the world. Guess what? Governments are now stepping in and say, you know what? I'm going to give you some money, right, to work on vaccine development, right? Usually does not happen, right? That's usually does not happen where governments like pouring billions of dollars for you to try to, come up with a vaccine. So now you get the government support, right? So now the next step is, well, now that I got, the money, right? And now that I got plenty of people who have this vaccine, I need some people who are willing to get into a study. Now I can tell you what typically happens, right? And especially I've read a whole bunch of studies, right? What typically happens is you don't get a lot of people who are ready to run and jump in your study, right? Just because you pay them or whatnot, right? That usually does not occur. Right. But guess what happens, right? In a pandemic, right? In a pandemic where all of a sudden now you got to wear a mask every day. Right. Like, and I tell people right there, there's people who I've been taking care of for the past year who probably have no clue what I look like because all they've seen is my eyes. Right. And that just is what it is. Right. They probably have no clue whatsoever what I look like because all they've seen is my eyes. So now you have, a whole bunch of people with a disease. Right. You have a whole bunch of money because you have government support. And guess what? You have a whole bunch of willing participants, right? And by willing, let me show you. Let me just say some numbers. 43,000 in the Pfizer, 30,000 in Moderna, 60,000 in Johnson & Johnson, right? Like, again, these are crazy numbers to think about in such a short span, right? But people were running. They were running to get into these studies, right? Because they wanted to see is there ever going to be a day where I'm going to be able to go out in public again, right? And deal with, and not have to wear a mask, right? Can I go to Publix, right? Can I go to the supermarket? Can I go out to the clubs? Can I go out to the bar? Can I go to a concert, right? People want to get back to that normal life. So they ran, right? Right, to these studies, right? So again, you're having this is just a situation that usually does not occur, right? Like you don't typically have all of these factors happen all at the same time. So that's why we have these vaccines that pop up out of nowhere and that, came out nowhere and came up really fast. No, it's just that we're in a pandemic and everything that could happen to speed up production to get a vaccine out to you guys, the general public, right, happened to occur because of this virus, right? So again, that's the background educational aspect of how you're able to get a vaccine out to the masses this quickly, right? And again, we're on our third one, Johnson & Johnson, right? It's a different type, right, than the first two, the Moderna and Pfizer, right, which is great, right? Because now you don't have to hear about the mRNA ones, right? So you have that, right? So you have to, one, answer that skepticism. How are you able to get this vaccine out so quickly? Two, you have to understand, especially people of color, right? We have been wronged by the medical society, right? And I think I would be naive, right, to act like that didn't occur, right? Like I've talked about this before, right? People always talk about Tuskegee, right? Tuskegee seems to be like the one that people always know about, right? We already know about Tuskegee, right? Henrietta Lacks, right? We know like Henrietta Lacks is probably just as significant as Tuskegee, right? Right. And there's a slew of other, race-related, atrocities that have occurred to people of color. So when people have a hesitancy, right, to a vaccine, right, it ain't personal. I don't take it personally, right? I understand, right? And you have to come at them and say like, hey, I understand, right? But like, let me tell you something, right? As long as Dr. Pierre is in the medical field, right? Like Tuskegee's not happening, right? Like as long as Dr. Pierre is right here, right? Henrietta Lacks not happening, right? Like we're gonna we got our eyes, right? Like we're not dumb, right? We're not gonna allow, right, them to give one community a good vaccine, another community a weak vaccine. That's not ever happening again, right? So you have to let people know, there are a lot of physicians, right, who are on their side, who understand, why, the hesitancy is there, right? And are ready to fight and battle for them. Right? Because at the end of the day, I want everyone to get the vaccine who can get the vaccine. If you got valid reasons why you don't get the vaccine, like I'm here for you, right? But like I don't want you not to get a vaccine because you don't trust the government, right? Like because that's not a good enough reason, right? Like I said, 509,000 people died. Boom, out of here, right? Not coming back home, right? 509,000 people, right, are dead right now, right? And it's going to be higher by the time that we hit 2022. That number is likely going to be, I mean, if I had to guesstimate, probably in the 700s, right? If I had to guess, and that's with the vaccines helping slowing things down, right? That's what I'm hoping, that the vaccines help slow some things down so it doesn't race up to where we're talking about closest to 1 million. Crossing our fingers there. But because that's what it is, right? So we have to be very, very, very diligent, right? We have to be very, we have to just educate ourselves, right? Question everything, even question everything you heard today, question that, right? Say, yeah, I like what Dr. Pierre talking about, right? But like, I'm going to just read up again just to make sure like he knew what he was talking about, right? Like it is extremely, extremely important, right? For us to be educated as much as we can. But I could tell you, like, we should be very excited right now. Right? Like I said, the Johnson & Johnson, right, is amazing, amazing news, not only for our country, right, not only for underserved areas in our country, but underserved areas in across the world, right, that don't have deep freezers, right, to hold and contain those two new ones, right? The Johnson & Johnson is going to be an amazing feat. We're very excited about it, right? Like I said, I am here, right, to answer any questions, concerns you guys may have. Like I said, feel free, depending on wherever you're watching this. If you're watching it on Facebook, YouTube, Twitter, where else were you streaming? Facebook, YouTube, Twitter. Oh, and both my groups, right? If you're watching that, feel free to DM me any questions you may have. Instagram, same thing, right? Like DM me any questions you may have. I want us to be as educated as possible. So when it is time to get our vaccine, right, like we are ready to run in lines, right? Like that just is what it is, right? So I am, again, yours truly, right, Dr. Pierre, board certified internist, host of the Lunch Learn with Dr. Barry, right, like host of Empower Yourself for Better Health series on YouTube. We have Medicine Mondays on YouTube now. Like I think I may do like a Friday live stream on YouTube now, like every Friday night, because I'm kind of liking this Friday vibe, right? So we may even add that as well too. Yeah, guys, be blessed, right? Like I said, again, we got again, we're not done yet, right? Let me tell you, right? We're looking at 2022, right, for us to have a quote unquote normal life. I want to make sure I pop any, burst any bubble, right, of people thinking that like by like Thanksgiving we're ripping masks off and we're right. Like no. This is a 2022 thing. Like the stuff we're doing right now is so that in 2022, right, we can get back to a sense of normal, whatever that normal may be for you, right? Like that it just is what it is, right? Like again, we got to be real. We got to be honest with you guys, right? That's what I'm here for. So you guys be blessed. Have a great night. Like I said, any questions, feel free. Hit me up. Bye.